So today I'm going to show you how to do an NG tube insertion. I would check my provider's orders before entering the room, and then I would want to gather all the supplies that I need, and I would go into the patient's room and I would close the door or curtain, perform my hand hygiene. Then I would want to make sure that my patient understands why we are doing the NG tube insertion and explain that it's a little uncomfortable, but at any time that they would like us to stop, that we will take a small break and then proceed. Once they understand, I will then put my gloves on and open my supplies. Once my supplies is open, I will take the tube out. You would want to lubricate the end of the NG tube with like water soluble lube. I will then measure from the tip of their nose to the earlobe, and then I would measure all the way down to their xiphoid process, and I would want to mark that on the tube. That way I know how far to insert. And so once I know all of that, I will begin to insert and ask them to breathe. And once it gets down towards their mouth, I would want to ask them to take a sip of water and continue to insert the tube. And if they start to gag or anything, or can't breathe or start persistently coughing, I would want to stop. Once it is inserted, I would want to make sure that I continue and like make sure that my mark on the tubing is still there and that you can see it. That way, if it does come out or if it moves at all, we know how far it's supposed to go back in. And I would want to secure it to their nose and then ask them to turn their head to the opposite direction and secure it to their gown. Once that is all done, I would want to make sure I looked in their mouth and make sure it's not like curled up in the back or anything. I can look and see if the right color gastric fluids come out. I can get an x-ray, which is the gold standard, to make sure that the NG tube is in the correct place. I can also listen for anything like that. And once all that is done, I would want to be sure to put my patient back in a comfortable position and that they have to sit up at least 30 degrees and that they are comfortable. That is all.